emergency needle decompression. Needle decompression of the chest is a life-saving procedure that is quick and easy to do in patients with a tension pneumothorax. After a chest injury, air may become trapped between the lungs and the chest wall. This causes too much pressure on the lung, the great vessels, and the heart, and results in poor blood flow from the heart and difficulty breathing. Placing a needle through the chest wall at the upper edge of the third rib, in line with the midpoint of the clavicle, will immediately release the trapped air and relieve the pressure. This action will stabilize the person to allow time to place a chest tube. The patient with tension pneumothorax is severely short of breath. Listen for breath sounds. There will be silence or a loss of breath sounds on the side with a tension pneumothorax. Percuss the chest. The side with a tension pneumothorax will sound hollow or hyporesonant. Then, check the patient's neck. The trachea might shift away from the side with the tension pneumothorax. The blood pressure will be low and the pulse rate high. Quickly gather your supplies: a 14 to 16 gauge IV cannula, an alcohol swab, and a non-rebreather mask if possible. Give the patient oxygen at a high concentration using the non-rebreather mask. Wear gloves and goggles. The cannula is inserted above the third rib into the second interspace at the mid-clavicular line. You may hear a rush of air. Here are two ways to identify the landmarks. On the affected side of the chest, find the ends of the clavicle. Then, estimate the midpoint. Next, find the spot between the manubrium and the sternum. Feel a bump in the bone as you rub your fingers up and down the sternum. Move your first finger perpendicular to the clavicle and your second finger to the left or right chest. The insertion point is where the fingers meet. In the second way, at the midpoint of the clavicle, feel the space directly below. The rib below that space is the second rib. The next rib is the third rib. The needle is inserted above the third rib at the mid-clavicular line. Clean the skin. Then, insert the needle straight in, perpendicular to the skin. Slide the cannula over the needle and remove the needle. Then, tape the cannula in place. Now, check to see if the person is improving. The lung sounds should now be on both sides. The breathing less labored, the pulse improved, and the person may be more alert. If there is no improvement, insert another needle lateral to the first needle. Arrange to have a chest tube placed as soon as possible. Remember, do an emergency needle decompression if you suspect a tension pneumothorax. This procedure will buy time as you arrange for a chest tube.